As we get older, our bodies change in many ways. We may eat less, spend less time outdoors, or take medications that affect how we absorb nutrients. Even people who think they eat a healthy diet can develop vitamin and mineral deficiencies without realizing it. These deficiencies can contribute to fatigue, muscle weakness, memory problems, poor immunity, and fragile bones. The good news is that many of them can be identified and managed with the right diet, lifestyle changes, and, when appropriate, supplements. Let's look at the most common vitamin and mineral deficiencies in older adults. 1. Vitamin D, the sunshine vitamin. Vitamin D is one of the most common deficiencies in people over 65. As we age, our skin becomes less efficient at producing vitamin D from sunlight. Many older adults also spend more time indoors, reducing their exposure even further. Low vitamin D levels can lead to weak muscles, bone pain, increased risk of falls, osteoporosis, higher risk of fractures. Good sources include oily fish like salmon and mackerel, egg yolks, fortified dairy products, and fortified plant-based milk. In many cases, healthcare providers recommend a vitamin D supplement, especially during the winter months. 2. Vitamin B12, essential for the brain and nervous system. Vitamin B12 is vital for healthy nerves, brain function, and red blood cell production. As people age, the stomach produces less acid, making it harder to absorb vitamin B12 from food. Certain medications, including acid-reducing drugs and some diabetes medications, can also interfere with absorption. Symptoms of a deficiency may include tiredness, memory problems, numbness or tingling in the hands and feet, poor balance, anemia. Vitamin B12 is naturally found in meat, fish, eggs, and dairy products. Some people may need fortified foods or supplements if absorption is poor. 3. Calcium, building strong bones. Calcium is essential throughout life, but it becomes especially important in older age. Without enough calcium, bones gradually lose strength, increasing the risk of osteoporosis and fractures. Signs of low calcium can include muscle cramps, weak bones, brittle nails, increased fracture risk. Good dietary sources include milk, yogurt, cheese, fortified plant milks, tofu, and leafy green vegetables. Vitamin D is needed to help the body absorb calcium effectively, so these nutrients work together. 4. Magnesium, the overlooked mineral. Magnesium plays a role in more than 300 chemical reactions in the body. It supports muscle function, nerve health, heart rhythm, blood sugar regulation, bone health. Older adults often consume less magnesium than recommended. Symptoms of deficiency may include muscle cramps, weakness, tremors, fatigue, irregular heartbeat in severe cases. Good sources include nuts, seeds, whole grains, beans, and leafy green vegetables. 5. Iron, more than just energy. Although iron deficiency is less common after menopause, it can still occur due to poor diet, digestive disorders, or slow blood loss. Iron deficiency can cause fatigue, shortness of breath, pale skin, weakness, reduced concentration. Iron-rich foods include lean red meat, beans, lentils, spinach, and fortified cereals. Persistent iron deficiency should always be investigated by a healthcare professional because it may indicate an underlying medical condition. 6. Zinc, supporting the immune system. Zinc helps the immune system function properly and plays a role in wound healing and taste. Older adults with low zinc intake may notice frequent infection, slow wound healing, reduced sense of taste or smell, poor appetite. Good food sources include meat, seafood, dairy products, nuts, and seeds. 7. Folate, supporting healthy blood cells. Folate, also known as vitamin B9, helps produce healthy red blood cells and supports DNA repair. Low folate levels may contribute to anemia, fatigue, weakness, poor concentration. Leafy green vegetables, beans, lentils, and fortified grains are excellent sources. Don't forget protein. Although protein isn't a vitamin or mineral, it's one of the most important nutrients for healthy aging. After the age of 50, people naturally lose muscle mass, a condition known as sarcopenia. Getting enough protein helps maintain muscle strength, balance, mobility, independence. Good sources include fish, poultry, eggs, dairy products, beans, lentils, tofu, and lean meat. Who is most at risk? Older adults may be more likely to develop nutrient deficiencies if they eat smaller meals, live alone, have difficulty shopping or cooking, have dental problems, have digestive disorders, take multiple medications, spend very little time outdoors. Should you take supplements? Not everyone needs supplements. The best approach is to eat a balanced diet rich in whole foods. However, some older adults may benefit from supplements, particularly vitamin D or vitamin B12, depending on their individual needs. It's always wise to speak with a healthcare professional before starting supplements, as some can interact with medications or be harmful in excessive amounts. Final thoughts. Healthy aging isn't just about adding years to life, it's about maintaining strength, independence, and quality of life. Paying attention to key nutrients like vitamin D, vitamin B12, calcium, magnesium, iron, zinc, and folate can help support healthy bones, muscles, the immune system, and brain function. Small dietary improvements today can make a significant difference in health and well-being for years to come. If you found this video helpful, don't forget to like, subscribe, and share it with someone who could benefit from this information. Thanks for watching, and I'll see you in the next video.